Would you work 3.5 days a week for £140,000 a year? Yes, me too. So, if GPs go on strike in the middle of an NHS waiting list crisis, will they have your sympathy? Well, that could be tested very soon, because 3/4 of GPs in the NHS want to go on strike. In 2022, a study commissioned by the Department of Health shows that 58.4% of family doctors were working 6 half-day sessions or less. The salary for a GP can range from somewhere in the region of 78 grand to £104,000 a year, but many of them are partners in their practice and therefore paid significantly more. They're blaming their workload. So, isn't it time GPs started complaining about record net migration? Our population has grown by millions and millions of people. Do they think it's a coincidence that they've got more patients to see? Now, one anonymous GP said, "It's a shame that it has come to this, but I now feel that the government will not engage in meaningful discourse without understanding the level of dissatisfaction currently felt by GPs about pay and working conditions." I think that's rubbish. 78% said they were striking due to concerns about patient safety. More rubbish. They weren't concerned about patient safety when they refused to do face-to-face appointments during COVID. Even after the pandemic was basically over, they had to be reminded by the General Medical Council that they had a duty to their patients to do that. You know how you can tell their concerns over patient safety are rubbish? Because they might time it to coincide with an autumn election. Yet again with these strikes, you barely have to scratch the surface before you realise this is just political. The latest ONS figures shows there are 3 million more people currently on an NHS waiting list than previously thought. The ONS survey found around 1.35 million people have been waiting over a year. GPs also want to strike because of a lack of funding, all right? So apparently they've been given a 2% pay increase, £259 million more funding. The issue is less about funding and more about waste, I think. One GP with 35 years of service has bravely come forward as a whistleblower. Dr Claire said, "Where do I start? I hardly recognise the NHS as it is now in comparison to when I started working 35 years ago. In that time, the number of managers has increased exponentially, and they've taken over from clinicians in running it. It is now neither effective or efficient. They're obsessed with filling forms, ticking boxes, hitting arbitrary targets, not caring for people. More than 50% of the NHS staff are now non-clinical. Then there's the huge waste and inefficiency, which would be neither tolerated nor sustainable in any business." Yesterday, I exposed the radical, Marxist, pro-Palestine, race-obsessed teachers' union boss who wants teachers to strike in time for the new school year. Well, today, you've got well-paid GPs potentially striking to coincide with a general election. Is the public sector really willing to sacrifice both education and lives for political reasons? It seems so.